My name is Aljamal Bindon. I'm the chair of the Moore Center for Movement in Omaha for Racial Equity. It's been around for about 10 years, and we've did a lot more with race in the last 2 or 3 years. A lot of things we do related to on the internet, Facebook Live, and so on. So this is one of the few meetings we've had in recent years because of COVID, and we're also happy we can hold it here. And so what I'm going to do before we get into the meeting now, we always allow the host who allows with the most to say a little bit about the location, because some people, this is their first time being here. So we want Manning Cook to say a little bit about what this location is about, just a little bit, and then we'll get more into what we're about tonight. Again, very informal. We're doing this like a fireside chat here, so as you can see, it's very informal, and so we're kind of excited you're here today, and hopefully we'll walk away with some more information that can help make our state and our community better. So, Manning Cook, I'll let you go for him.
Hey everybody, I'm Manny. I'm the Director of Urban Planning and Design for Spark, and this is the Fabric Lab. And so what we do here is an urban design lab and community development hub. So on the urban design side, we're working on some housing designs right now. Designed, built, constructed the North Omaha Trail, which starts on the next block. Including public art and placemaking, have a series of fellowships and grant opportunities and that sort of thing. And I could keep going, but that's not what today is about. But I will also say at Spark more broadly, we have the Developers Academy, which is about training up emerging developers, loan fund as well, and we do a lot of policy advocacy work. And Cheryl's on the board now, so if she wants to talk about more, you can ask Cheryl. But I have to run. But if you have questions about the space, if you need to find out where the restroom is, or a paper towel, or whatever the thing might be, Kira's holding it down for us today. She's in the back, so that's Kira. And if you have more questions, you can ask her about it. And we have like some brochures and stuff in the front if you want to know.
But man, how long has this place been here? How long years been
For 2 years.
2 years in? Okay, got you. Okay, good.
All right.
Well, appreciate it. Okay, well, thank you. Appreciate it.
And a big hand.
Oh, and a big hand. Okay. I got to back up to the board here. Okay, appreciate that, Dennis. So, folks, as an intro to this, and I'm going to be very lay a foundation, not that long, but just a foundation of how this evolved. In the last couple of years, we've had the opportunity to have the three individuals here from the different divisions, Jennifer Carter, Doug Koebernick, I can pronounce sometime, and then Julie Rogers. They've done this before, twice on the internet. And we've done Facebook Live, but this is the first time they've done the three of them together. And so we're kind of excited doing something in North Omaha. We've had some wonderful conversations about their reports and things like that. And as we start to talk more and more, we found out that there's an opportunity where they can help build social capital and basically drill into some things that they do. The reports, if you look at them, it has some information there that has been repeated because it's not addressed, but they also have some reports that talks about things that have happened as a result of their work. So we're excited if they could be here, Jennifer, Doug, and Julie. And one of the things that's extremely exciting about is that I know Julie way back from Promiseship because she's done a number of forums in North Omaha when I was with her, so she had a chance to talk about child welfare when she was in that position. But this is one of those kind of situations where we need to bring our community together and talk about state issues and issues that happen to all Nebraskans. We don't do a good job of that, and particularly getting us to go into North and South Omaha. So tonight, what we'll have in mind is we're going to have each one of them introduce themselves, say a little about themselves. They also left their business cards over there if you need to catch up with them. One of the frameworks that we're real sensitive to is we don't want people to talk about their personal agendas in the public space, but they're available later or another time. But we're talking kind of like at the 80,000 feet level. But if there's something specific that affects a lot of us, you can share that also. But this will not be the first time here. They all indicated that they're willing to go to other meetings and even at some point maybe have other people contact them at different venues. So we're kind of excited about that. But what they're going to talk about tonight is their annual report a little bit. And I had a chance to read Jennifer's report and Doug's report, and I really like the graphics that Doug has in his report. He has some color schemes and grades and
I don't
things.
have to write as much.
Yeah, and he also talks about race very well in his report. And so one of the issues we wrestle with in Nebraska is getting racial data and geographic data and income like that, which is of concern to many of us. The other thing, they would talk about some of the corrective actions briefly. And then also, as you know, they've been facing a certain amount of scrutiny from the Attorney General. I know that they can only say so much in that area, but they're open to some kind of feedback. But we would like to have the public support what we're doing here. And again, to make sure that if we have a problem in state government, we know where to go to, and the ombudsman's positions in our country and in our community is extremely helpful, because some of us don't know what county government do, we don't know what city government do, we don't know what state government do. So these are the kind of individuals who can be kind of facilitators to help us do that. And some of you may have seen the little clip we had on the TV yesterday, but what we're trying to do is get our community to come together as neighbors and also to be able to challenge the systems to deal with some of the disparities in Nebraska. So without much further ado, I think I'm gonna have Julie Rogers start first, and then they're gonna go there, and then we're gonna give them roughly about, so much time to talk, and then we're gonna throw it open. And again, my role is to be the moderator and timekeeper, so I'm gonna stay out of the way. I'm not running for office, I run to office, but it's about the community here today, so we're gonna give them ample time to do what they gotta do. So Julie, why don't you start first?
Okay. My name is Julie Rogers. I'm originally from Randolph, Nebraska. After college, I took a fellowship as a Mickey Leland Hunger Fellow in Washington, D.C., and I learned all about policy. And that made me want to go to law school. After law school, I worked in a public defender's office in Madison County, northeast Nebraska. And then I came back to Lincoln and worked for the Judiciary Committee of the Legislature, worked on prison overcrowding issues. In 2012, I became the Inspector General of Nebraska Child Welfare, and now I am public counsel. Our office is also known as the Ombudsman's Office. We are an office of the legislature, and we take citizen complaints from anyone who wants to complain to our office about anything, any problems with state government, mainly as it has to do with the executive branch. The one exception is we do not take complaints about the governor or the governor's personal staff. So we don't take complaints about the judicial branch or the legislative branch. And we do take complaints about county jails and juvenile detention centers. So that's the only local government that we take complaints from. Most of our complaints, usually over half of our complaints are corrections related. This year it's well over half are corrections related. The next highest number in terms of state agency is the Department of Health and Human Services, and that could be the Youth Rehabilitation and Treatment Centers, the Beatrice State Developmental Center, the Norfolk Regional Center or the Lincoln Regional Center, Medicaid issues, behavioral health issues. We see a whole lot of different issues and we try and resolve those complaints. We are also the office for any state employee who wants to be a whistleblower. We are the whistleblower agency, so employees can come to us and talk about the challenging things that are happening to them in their employment with the state. And then within our office, we have 2 inspectors general. So,
good evening. Thanks for coming. I'm Jennifer Carter. I serve as the Inspector General for Child Welfare. I've been in the position about 3 years. I'm actually originally a Queens girl from New York. Came to Nebraska though, and been here about 20 years, so I consider myself pretty Nebraskan now. Also an attorney by training, and so, but when I came to Nebraska, I started doing a lot of policy work, including around child welfare. Eventually ended up working for the Health and Human Services Committee in the legislature, and then when Julie became the ombudsman, they needed an IG of child welfare, and I applied, and I've been serving since that time. So our office was created in 2012, as Julie said, after there was an attempt to privatize case management in the child welfare system, and it was a debacle. And so we lost a lot of private providers, we lost a lot of services, there were a lot of issues in terms of support and case management. And so there was a huge work by the legislature to take a look at what went wrong and what they want to do differently. And one of the recommendations of many, I forget how many there were, like 15 recommendations or something, was to create an office of the Inspector General, because what we're about is good government. I mean, it's all about accountability, transparency, oversight. So our role is to really make sure that the department is doing what the department is supposed to be doing, and as the legislature intended for them to serve children and families. The statute really directs our work and sort of sets certain priorities. So the most basic key thing that we are required to do is to investigate deaths and serious injuries of children in the system. And to be really clear, that is not the law enforcement criminal investigation. It's actually also not the abuse investigation. So the department's going to look and see, was there abuse, how did that happen? What we're looking at afterwards is, how did the system handle that case from the beginning? And I try to give simple examples. This isn't even from a real case, but if a child was hurt in a foster home, had they actually licensed that foster home properly? Had they done the home studies they had to do? What was happening? Is there ways that we can reduce the risk? I mean, both have they not actually met the law and the rules and regulations they're supposed to follow, but sometimes, as in with a lot of the investigations that are highlighted in our annual report, they may have been doing what the law and the policies required them to do, but there's a gap in the system, clearly, that's our role to try to figure out and to find. We also take complaints, and we get a lot of complaints from everybody, grandparents, foster parents, biological parents, people just generally concerned in the system. We can also investigate those complaints if they meet certain requirements of the statute, and frankly, if we have the time and the resources to do it. We are a pretty small but mighty team. There's really only 3.5 of us, because Doug and I split one position. So that is really the focus of our work, and as I think we'll probably get into more, a lot of it is driven by the information we get, and that's why it is so important, and we're trying to reach out more to community members and community groups that are working directly with families affected, because we don't know what we don't know. The state agencies are required to report some things to us, but otherwise we need to hear from people to really understand what are the challenges. So yeah, that's kind of our basic, over the years we've vetted, and we look into every single thing that comes into our office. So in 11 years, that's over 5,000 incidents, complaints, grievances. We've put out 44 reports, 115 recommendations, 84 of which the state agencies have accepted and actually made some progress on. And so that's the type of work that we do. And actually a lot of our work has also led to changes in the law, which is one of the main points of our role, is to inform the legislature. Is this working? Is it not? What do we need to do? These are the places they've created and appropriated money to, and is it actually working the way they wanted it to work? So that's kind of what we do.
Good, thank you. Doug?
And I'll just stay seated. My name is Doug Koebernick, and I am the Inspector General of Corrections for the legislature. And I've been in this position for just a hair over 8 years. It was created back in 2015. And it was the result of a special committee on corrections that started to focus on Nico Jenkins and related issues, but then it expanded beyond that and started to highlight and focus in on a lot of different issues that were going on within the Department of Corrections. So out of that, a lot of what Jennifer just said, you can just strike Health and Human Services and insert correctional services. But one of the recommendations was to create an office and pattern it after the Inspector General for Child Welfare. And so that's what happened. So in 2015, the office was created, and like I said, that's when I started. Prior to that, I worked for the legislature for about 18 years for 4 different senators, and was involved in a lot of different issues over the years, including juvenile justice, criminal justice. I worked for Senator Lathrop for 6 years, so we were involved in that special committee, but before that, the Beatrice State Developmental Center Special Committee, I staffed that. So I was involved in a lot of different things over all that time and everything. But so since that time, the office was created. Our role really is to look at the Department of Corrections and the parole division of parole supervision, not the Board of Parole, but the division of parole supervision. And we really look at serious incidents, serious injuries, deaths, systemic issues, all those kind of things that we have our hands in and are looking at. And we do individual reports on certain specific incidents. We also do our annual report, which we're here to talk about tonight. But I would say, really, what we do is listen to people and review all those things, but we hear from a lot of different people, whether it's people that are incarcerated, their families, or their friends. We hear from staff to really get a better understanding of what is going on throughout the system. So, I mean, different issues that we've looked at over the years have been restrictive housing, staffing, just the facilities. I could go on and on, but we have in our report, I don't remember how many recommendations we've made over the years, but it's a pretty significant number, and this year we included them at the back of our report, so if you want to see some of the things that we've done in the past, that would be one way of seeing what we've done. But I'm really excited to be here tonight and to hear from people, because that's a key part of our role, is to hear from other people about what's going on in the systems that we are connected to.
Good. Before we open it up, I want to throw out like 3 questions, and then we're going to open it up, because there were some things they said I want to clarify. How much money do y'all spend, or do you have outreach and PR funds to do outreach like this in your respective offices?
No, we don't have.
Okay.
We don't have.
So there's no way.
So,
Okay,
yeah,
go ahead.
we have put together a marketing committee of volunteers within our office, and we're trying to get some updated marketing materials, but that's about it. We just don't have capacity. It's so we try and do it when we have time. So that's why I really appreciate you inviting us here and organizing this event, because without that, it just...
Okay, I was wondering, I didn't know for sure if they had any of that.
Yeah.
And then the second question, I think I alluded to, maybe, I think all 3 of you alluded to, you make recommendations. What if they don't accept your recommendations? What do you do next? Because there's recommendations I've seen travel through the years and the same thing, but how do you deal with the recommendations that are serious or something, but they don't deal with? So how do you handle that one? And I'm asking each one of you in your respective areas.
I mean, really, it's the greatest, I guess, role that we have is just bringing it out into the public and making that clear and transparent, and to the legislature. So if they don't accept, if they reject a recommendation, we don't have any authority to do anything.
Okay. In your respective areas, corrections, child welfare in general.
Yeah, right. And on the ombudsman side, we try to be the problem solvers with the complainant, see if we can get something taken care of, in a problem solving. Maybe it is a misunderstanding or something. If we reach out and we tell the agency what is wrong, what gaps we see, what policies might be unfair, and then we make recommendations for improvement. But if they don't improve, or they might say this is not a problem, our biggest, I guess, power is just shining a light.
Okay.
We're a government accountability office, and that is, we can't compel any agency to do anything, or we're in the legislative branch, so we have a very independent structure to our offices, but we shine a light to things that can't be taken care of internally first.
And I would add to that, I mean, out of all the recommendations we make, sometimes they're accepted by that department or that agency, sometimes they're not. But our experience on my side has been that even there's times when they might reject them or not be ready to do those, and then we go back and look later because I still want to follow up on those, and then we find out, oh, they did do something.
Yes.
Yeah.
And so even though we can't compel them, sometimes, I mean, they listen, and sometimes they accept it and sometimes they don't. So, and there's times when we've had to revisit that. If some other issue came up or incident came up, and we might go in and go, well, you know, back in the past we recommended this, we stand by that recommendation still. So that's a really good, important role that we play.
And we are obligated actually to follow up. So we can't require them to do anything, but the legislature asks us to go back and ask them every year, have you done anything on this? Where are you on the implementation? And then it's actually in the back of our annual report. We have to put it in to say, here's what they've done so far on this or not done. So that is again just shining light and information that then others could try to do something with it.
Yeah. And by the way, they have copies of their some of the reports there, but also handouts where you can find the report on the internet. So those are up on the table, so feel free to. And then my last question, before I throw it out to the audience, I'd be remiss not to go here because more deals with racial issue. I want to commend Doug. His report had so much racial data. It was like, wow, he talked about that. So I want to talk a little bit and ask the question, how do you collect or not collect racialized data when we have a state of Nebraska that's 20% people of color, the city of Omaha is 33%, and again, a high percentage of kids in child welfare, foster care system, even in DCYC, I saw the numbers as 80%, 90% Hispanic and Latino, African Americans, Latino, and so on, and immigrants. How do you collect data, and why is that such a challenge in our reports or in our system with state government? And again, it's not just your departments, but Department of Education, OPS, you name it. People sometimes don't have that data out there, but how can we deal with that? And give me a little bit more feedback, maybe, Doug, how you got your stuff, and help us to understand how can we expand that same template to other areas that we are talking about, geography and other issues that we deal with in our state.
Yeah, in the past, I mean, we put that in our report because I think it's really important to have an understanding of the racial breakdown of the correction system and the parole system. And we've been able to obtain that data from the Department of Corrections through their computer information system. And so I could go in and I can pull all that data and understand, like, okay, how many people are in this housing unit and break it down by race, or how many people are in restrictive housing and break it down by race, things like that that we'd like to do just to kind of give a better idea of what's going on within the system. This year we provided data and compared it the state data as far as racial breakdown, and then compared it to the corrections racial breakdown and parole and probation. And so you have those 4 different measurements. So you can see if there's some differences between the state population and what's going on. A few years ago, actually, it was really kind of eye-opening when I found out that I think Native American women were overrepresented in the correction system by like 10 times what they were in the state. So looking at that is really good. Then you kind of wonder, like, what's going on, what's driving that, and all that. So that's one of the things that we've really looked at. We think it's important. Like to do more. Even the other day, the department released the restrictive housing report. And restrictive housing is when people are put into a very limited movement setting where they might be in there for 23 hours a day in their cell. They don't have a cellmate, and they just get out like 1 hour a day maybe. And they released that data that showed the breakdown by race too. So that just came out, I think, like 2 days ago. So those kind of looks and examinations, I think, are really important. And then it's kind of, where do we go from there, though? Because we have that data, then let's look at it. We can go a little deeper here and there and try to get a better understanding. For like in the restrictive housing, the Hispanic population is much more overrepresented in the restrictive housing setting than the rest of the correction system. Okay. So that's, I mean, there's all sorts of different data points that we can look at.
Okay. And Jennifer and Julie, in terms of child welfare and the whole issue of unemployment, do you have racial data there a little bit?
So we don't collect the data directly, and I don't think there is as granular and good data, just even from others.
You mean other departments?
Right, so that's not something we collect, but like Foster Care Review Office does, although that is only for children who are in out-of-home care. Okay. So if you're talking about the whole system, because so many, probably almost half of the kids are not in out-of-home care. They're involved in the system, but they're still maybe at home, or so I don't know that what we're getting from HHS is as clear as that, and as broken down as carefully. There is this one child abuse and neglect report that they usually put out. It was not released before our report came out. So, but actually, that is something that I think maybe we could think about doing is sort of trying to provide some aggregate data in our report. It wouldn't be our data, but we could repeat data that others have put out. The struggle for us is because so much of our work is directed by the information we get. What we tried to do this year and are trying to do a better job of is, okay, if we get complaints and incidents, to be tracking ourselves. Sometimes we don't know. We don't have the racial information in it because it can be self-identified. Some people don't give it. Maybe it's not in the system, and so that makes it trickier. But for what our work is, we're trying to identify the trends. So we refer to it as staffing, but we do some investigation and vetting. Investigation's maybe too strong a word, but it's a really deep look at the complaints and what we get in to determine, do we have jurisdiction? Does this need an investigation? And as part of that conversation, we're trying to pay attention to, are we seeing trends based on race and equity? But it's really hard because there's, again, things that we don't know. I don't know what I don't know.
Right.
So if I'm not hearing that here's what's happening in this community all the time, and here's a trend in terms of policy violations, or then it's harder for us to dig in and try to look at that. But so we're just looking at it as much as we can. But again, I continue to feel like I want to do a better job on that. And I think it would be helpful if we could connect with more folks in the community and how best to hear from people. Like, people may not want to call us. They may not have time to call us. Do we need to sit in a library somewhere some night and, make ourselves available? Like, that's the kind of information we're trying to figure out.
Julie, how do you do it in general? How do you handle it?
For our complaints, most of our complaints come from incarcerated individuals, and they come via letter. And we get to work on those right away, and honestly, we don't have a opportunity to ask about race at intake. We have not collected that in terms of complainants complaining to us. With most of our complainants coming from county jails and the prison system, we know that there's an overrepresentation of people of color. So we all have an understanding of that in working with the cases. I am open to doing whatever best practices are to help our work. We also do take complaints about race when it comes to a state agency and how people are being treated. And so then we would ask for that data from each of the agencies, depending on what the complaint is.
Good. Well, at this point, folks, we're on our time zone here, and this is good. And so at this point, we throw it out to the audience and people who are here to raise questions, comments, or whatever.
I got a question.
Wait, hold it.
We will go tag team.
Hold it. Also, the moderator now. Don't forget that. The moderator. So we'll go with this. We go behind you. Okay, good.
All right, thank
We
you.
got you covered. No, we got it covered. It's plenty of time.
Am I go with
Well, Dennis first, then we go back. But nobody's going women's first. But that's
So
okay.
since you're appointed
women?
We got you.
and you are restricted from reporting on the chief elected official and or any of his staff, how do you actually make an impact when it appears as though that you're handcuffed? And I say that because it seems like the system is set up for you to fail. And you're limited in the scope of what you can do. And then we have individuals who are in elected positions who want to eliminate your positions within the state. I believe we need to have more within the state so that we can eliminate some of these issues that we have regarding child welfare with our criminal justice system, and specifically this awful juvenile justice system that we have here. We need more, if you want to put it in a negative way, of whistleblowers, and they need to be paid as well. So how can you really organize with real community grassroots organizations to really start making an impact to create positive change within this state?
Yeah, I think the Ombudsman's office has been around since, I think, or the last 50 years. So
I think since the 70s when Kerry
or
was in office.
late 60s even.
Yes.
So more than 50 years. And I believe it was constructed to outside what the governor's doing, because in terms of government oversight and our standards and principles, we're looking at things objectively, not in a politician sort of way, but how are these agencies functioning? And then if we find we are shining a light on the problems, then the politicians have to account for what those problems are, or the voters, things are made public, then the voters can be more educated in how they vote, or in speaking with their representatives. I think that's how it's set up. It can be frustrating, and I know that complainants can be frustrated too, because our powers are limited. And I talk to folks, what can you really do for me? Because we're not direct service providers. We are the government oversight people to make sure that those who are in agencies to provide services there, it is good government.
And I would just,
Oh, yeah, go ahead.
So, that I think that is something that is important and tricky sometimes to be explaining because of the frustration that actually, when we talk about not having the authority to direct and make somebody do something, I don't want to undersell the power of transparency and accountability. And that in and of itself is very important, I think, in a government system. And so we might not, we can't, and also just generally, like the way we're set up is pretty, actually we've done a pretty good job in Nebraska in terms of setting up the framework of government accountability, independence, the way it's done. I mean, there are national standards, ways that we do things that I think are good here, but it's just the nature of government accountability that we can't also be advocates. We have to be the people who are shining the light, and then others can carry that forward if they need to. So I think that's the challenge, because it does, we're all working towards a better, always the best system, right? So we're all doing that, but we have our certain role to play, and so while we can't make somebody do something, I also think it's really important just to say, here's what's happening, here's how it's working, and then that becomes itself important.
Ma'am, you next. You got you.
Yes, my question is directed to you, Ms. Carter.
Yeah.
And in regard to the foster care complaints, do you think the reason that we don't or aren't able to solve some of them is because the understaffing of the case managers? They are so overloaded. Because I have worked in the system for years, and some of my clients have had, within a several months period of time, 3 or 4 caseworkers.
Yeah.
So if you're switching off that often, how are you getting any information?
Right. No, I think that's absolutely true. It's something we've heard for years and years. That not only are we losing folks rapidly, so there's so much turnover, that affects not only how many caseworkers a child has, and the chances of your permanency and your length in the system, like chances of permanency go down, your length in the system goes up, the more caseworkers you have. That's a huge problem, I think. Not only that, but it's actually hard on the caseworkers, I think, too, because with those who stay, and because now a lot of supervisors, we no longer have the veterans in the system that we used to, where you could go to somebody who's been there for 20 years and say, we've seen this, here's how I can handle it. The mentoring is harder. All of that, I think, is
Well, I understand what you're saying.
18 months.
Yeah, but there was a time when if you got a complaint, the caseworker actually went to the home, investigated. They don't do that no more.
See, that's something we'd like to know about, because they're still required.
You're getting secondhand information all the time. They literally went out to the home and investigated whatever the complaint was.
Yeah.
And actually put that house under investigation until they solved the problem. The caseloads have gotten so heavy, everything's done by the telephone or the computer.
Yeah, that is, I'm interested to hear that, because, I mean, clearly a lot of calls come in and get screened out, but the ones that are sent for investigation, they are still supposed to go and actually physically see the home and the child, and they've actually been shortened the priority time frame. Right. If it's not reported, then then
that's what I'm saying. The way we used to do things back in the day, where they would just make the visits, randomly or with an appointment. You can see things like that. Okay. I got a question for you, Doug, please. You said that you keep people and let them out for an hour a day. I want to know, how are you dealing with?
Wait, Doug don't keep him, man. No, he don't keep him. So Doug's not the prisoner guard. Hold it now.
No.
He's not the warden.
You understand what I'm saying?
Okay.
But I was wondering, how are we dealing with that? It seems like that would complicate things, because then you got the mental health factor, then you got to do that medical. It seems like that would cost more than to just let them out a couple more hours a day.
Yeah, I mean, that's an issue that it was brought up in 2014 by that special committee, and it's one that's been out there ever since. And so we keep looking at that. And there's been some legislation that's been introduced. And I would say one thing about our role too is that we educate the legislature, like they said. We also, the public is more aware. The media listens to what we say and gets that word out too, so that there's much more knowledge and education out there than maybe before, which I think is really good. But on that restrictive housing, that's a really difficult issue, because in the past, when the legislature has introduced legislation to expand the number of hours out of cell, the department at that time pushed back and said we don't have the ability to do that because of either the structure or the staffing and things like that. Jason in the back row there and I went out with some members of the Ombudsman's office, and we went out to Colorado to look at their restrictive housing system to try to get a better idea, because they had made changes where they were having groups out at a time, they're getting more out of cell time, things like that. So there's lots of examples out there, and I know Nebraska sent people to other states to the system, but that is a real challenge. I will give one of the things I highlight in my report is that the number of people in restrictive housing has gone down, but that's also because they've changed and added some new housing units where it's kind of semi-restrictive housing. So it's kind of a give and take, but I do acknowledge that they have reduced that population. And I raised the issue of people being in restrictive housing for a long time, and what I put in there was there's 9 people who've been in restrictive housing for 2,000 or more days. And I will give the new director a lot of credit, because if you look at what the number of people that were in a setting for more than 6 months, in that setting for more than 6 months at the beginning of this year versus now, it's gone from like well over 100 to in the 40s, I believe. So he's made some changes to bring that down. And one of the things too that we highlighted in there was, out of those 9 people, one of those will just jam out unsupervised in December, and there was another one who's been in for 1,400 days who do the same. And so, bringing those issues and shining a light on it, I think, is really important and educates a lot of people, and that's one of the things that we can do.
Can you explain the jamming out, why that is bad?
Yeah, jamming out is when you're just leaving the prison, you're not having any parole supervision or the probation post-release supervision. So you walk out with, you could have a plan, but no transition.
Ease into the community.
We got 2 questions by the way. Shelley first, come on camera.
Shouldn't
Go
you add
back.
on that? I'm not asking a question, to be clear, and let people know. The jamming out is a problem because they haven't had anything to help them throughout those 2,000 days. There's been no mental health check. There's been none of that. And what this new restrictive, be clear and honest with people, because the report that you're talking about came out a couple of days ago or whatever. Restrictive housing is no more than the new terminology for solitary confinement.
Wow, break it down. Good, very good. Appreciate it.
One of the things too the legislature did a few years ago is require the department and the Board of Parole to put out a report about the number of people who jam out and provide more information on that. So that comes out every January. So that's a really good education piece out there. The legislature's been very much invested in this.
We got 2 questions back here. Shelley, let me come back to the camera. We'll go back behind you. I'm watching who's next.
Restrictive housing and kids. What do you know about like DCYC and restrictive housing and any changes they've made in the last, I think it's probably changes they've made in the last couple of years for restrictive housing here?
That is not something we've gotten any complaints about.
Oh, so you don't, okay.
So,
A bill passed about 5 years ago.
yeah.
The ACLU, that the banning of children, pregnant women, and vulnerable adults. However, it's language, which
Right.
needs they're not in restrictive housing, they're in room confinement, not confinement.
Yes,
that was
they
it,
call
yeah.
it room confinement, so we try to monitor the number of hours we're required, well, they are
Okay,
required
so
to.
room confignment for DCYC, do we know
Yes,
any
room
changes in that in the last 5 years?
No, I think the only difference is that, honestly, and we say this every year in our report, facilities are required to report room confinement hours to the legislature, and then we are supposed to analyze that. We asked for the data in a way that we could actually analyze it, because honestly, the way they provide it to the legislature, it can't be analyzed. But the problem is, there's no, jail standards hasn't looked at making sure it's consistent. So we can sometimes compare a facility to itself from last year and whether they've done better, but we can't verify what they're telling us. We have heard over the years that there are ways that, you might, the law requires you to report it after an hour. Well, initially it had an after an hour, so you'd be in for 50 minutes, and then we'd take you out for 15, and then you'd go back. Then they changed it to if it's an hour at any point, combined in 24 hours, so that helps. So if you go in for 15 minutes and 4 times, then they have to report that. But it's just, everybody looks at it a different way. There's no consistency in how it's defined, how each facility is, and we ask for that, like, how are you, particular DCYC, what do you consider to be alone? What do you consider to be involuntary? What are you, and it makes it very tricky, and there are very, very clear best practices nationally, and that's what we've started comparing it to. But even still, it's really hard to assess. So we've had a bill out there to try to make that a little bit better, to see if we could get better data. But frankly, we need the folks who have the jurisdiction over those facilities, detention facilities, to create some standards to be monitoring it in a way that we can analyze it to see how much they're using it, how it compares to best practices, but we have no authority to go in and say, you've done it or not done it, or do a spot check. So that, I think it's a big issue, because we know it is really not great for youth's mental health if they are isolated for long periods of time. I understand there are moments where they need a cool down. Sometimes the youth ask for the cool down, which frankly then under the law is not confinement, because they've asked to go in. But they've tried to do what they can, but I don't feel like we're really, every year we kind of say, we can't make this better. Our analysis isn't going to make this better. We need other people engaged on that. Yeah.
You said you introduced a bill. Is that in response to what you were talking about, how you said they provide data that can't be analyzed? Is that what, and what bill is that? Is that something you're going to be doing next session?
It's sitting in committee right now,
Okay.
and it was just a way to ask them, well, 2 things, because we actually heard from some of the facilities, like they would actually like to some of them would like to report any moments of confinement, because it actually would tell. There have been a few who actually have been improving, and if you're not, I'm not telling you when I've only put them in for 20 minutes, you're not seeing the improvement, because the data we're getting is only the longer stages. So
What's
the bill,
I'm sorry.
I'm trying to remember the number.
That's okay.
I could get, if you
Between
take my
1 and
card,
about 800.
I know. It was Senator John Kavanaugh introduced the bill, and I usually have the bill numbers in my head, but for some reason I don't.
That's
So if you
okay.
email me, I can easily send you a link to it. And the other thing we wanted was to say, can the facilities themselves send us some key data points each year that we're pulling out of their data, in part because we want to make sure they're the ones sending us the data, it's their data, and we'd like them to be looking at it. We'd like them to be comparing it themselves each year to what, so, we can say it too, but I thought maybe if they're doing that as well. So that's kind of, it's pretty basic in terms of just trying to improve what we're getting. But even still, even with all of that, when you don't have consistent definitions, when you don't have somebody actually overseeing to see how are people tracking it correctly, I feel like that analysis is limited.
Right.
So.
Thank you.
Yes, we got here, and then we'll come over here.
I'm curious as to what mediums do you all use to blow the whistle or make public your findings? And do you have a budget, and where would that budget come from to enable you to make public your findings, that there might be some pressure for accountability for the different offices that you guys oversee and investigate?
Our budget for the whole Office of Public Counsel, which includes the offices of Inspector General, it is just part of a budget. We don't have a marketing budget.
Is it a state budget from legislation?
Yes. It's from the legislature. We are part of the legislature, so it's a legislative part. We're a division of the legislature,
Okay.
so we have our own under the Legislative Council. It's called. And then in terms of releasing, we do press releases or...
Yeah, and we have to, but if we do an investigation, a full investigation, we're actually required to do a report. And then there's a process in the statute for if we believe it's sort of more timely, we will ask, we have to work with the committee chairs to release it publicly in that moment. But no matter what, a summary of every investigation we do has to go into our annual report.
But what's the
we have a
setting?
website.
We're like the committee.
Oh.
Does it stay in committee once you let
No,
committee
no.
know?
No.
Is it news? Is it just published on a website somewhere? How does the public know
We always do a
that
press
this
release.
information is
Yeah.
okay? But
Press release, it's posted publicly on the legislature's website, and then we also have a separate OIG website. We post it there. And actually there's a little piece of paper with the page at on the legislature's website that has all of our reports.
Yeah.
So.
And I think it's a good point.
Yes.
It is a place where we could improve.
Yes.
That is something that
It's not.
it gets sometimes lost, the marketing of us, or we are so busy, and our capacity is to do the investigations, to solve these complaints, and that is our basic function.
trying to keep up with that.
Yes, and that is our budget. But you make a good point, and like in the IT world, I mean, people have said, "Who's your communications person?" We do that ourselves. We are our own.
Yeah.
So
We are our own,
that is.
I mean, I feel like you all should be household names almost.
Yeah.
But so there's a breakdown in.
Yeah.
Yeah.
I'll say this, that, I mean, like Jennifer and I released our annual reports about 10 or 11 days ago, something like that. And I mean, we did get a lot of coverage in the media because there's a lot of interest in what we do. I mean, I think 3 or 4 TV stations did stories about the corrections report, radio, I mean, newspaper. So we're pretty good at getting the word out because I mean, I think our reputation is very solid, and people know that when they read it, it's good work.
Oh, sorry, go ahead.
No, that's just good work and everything. And so, I mean, that's one way we do it, but I think we're pretty good. But yeah, we could always do better, and that's why we like to do more things like this, to make people more aware of what we do, and also to hear from more people too, with questions like that.
Folks, we got 2 questions on the floor. We'll go here first, and then we go go to you, Kevin. Okay? Sure.
I have a question, two-part question. With the Attorney General right now, and have you guys in the situation, a lot of people are saying, what's the point? Because they can't get to you. And then what can you do or say? Because the Attorney General is giving his opinion, and it's by somebody that you can't control, which is the governor and so forth. So right now, I don't see what you can do to bring it to the light if you can't do anything and people can't get to you. How are you going to get information? So what are you doing, or are you doing anything and just sitting there waiting?
Well, Attorney General's opinion is an opinion.
But it's put the stops on
We have enjoyed a lot of access to information from both the Department of Correctional Services and the Department of Health and Human Services. and that has slowed down since the Attorney General's opinion. So that is a reaction by those agencies. But you're correct, we do not run those agencies, but we are the government accountability offices for those agencies. And we continue to do our work, we continue to take complaints. It is slow going right now, but we are confident that we can, even though it's slow right now, that we will be able to shine the light, but it might take a long time in this moment in history.
And I think it continues to be important, maybe more important, that we're hearing from people.
Yeah.
The problem is we're not able to, it's a little slower to really figure out what's happening when we hear from folks, but it also lets us know, here's what we wish we could be looking at faster. And so that keeps us understanding what might be happening in the system, and I don't know, it's kind of a way of saying like, okay, here's why we would actually be important, because it'd be great to be able to move more quickly on this thing or that thing.
Yeah. And
we
work for the legislature, and they are the speaker, Speaker Arch, and the executive board chairperson, Senator Breezy. They are handling a legislative response, and we would expect a legislative response during session. And so we're trying to be patient because session doesn't start until January. So that's the position.
And the part is with the corrections, because of what I look like, which is black, African American, as people like to say, and which makes up a lot of the correction population, so forth. A lot of people are saying, we can't even get information to you because of what's going on right now. So what do you say to those people who say, I got a complaint, my complaint can't go anywhere, and therefore if you can't get the complaint, what can you do?
Well, we can still get complaints though, because I have proof on my desk. I have a nice stack of letters from people that write in from the prisons, and we do get phone calls as well, same with the Ombudsman's office. So that has not been shut off at all. The only thing that, as far as communicating with people that are incarcerated, it's my ability to go out into the prisons that has been hindered. So that has definitely impacted their ability for me to talk to a lot of different people in one setting, or to get out there and learn more. But at least we still, and we're encouraging people to write to us, to call us, to let us know what's going on inside and everything. And so I think that our calls have probably gone down and our letters have gone down, but we're still getting them in and encouraging people. I mean, when I talk to people,
well, there's a reason
know
why they're gone down. And I just got a last part of this because I got a shit cut of time. Do you think that this is, or who can shut you guys down and shut the office? Is it just that it has to come from the legislature to eliminate the office, or what?
That would be one, and then if there was a court made a decision that you were unconstitutional or something like that. So if there was litigation.
Thank you.
Do you anticipate that? Them trying to do that?
Right now,
Not
what they've been stating publicly is there's going to be an effort to try to solve the problem legislatively. But the law is intact right now, so we're trying to continue to do our work. So, yeah.
Where did this come from? You guys have been doing your jobs. I mean, Mr. Koebernick has been feeding information about the chaos in the prisons and the overcrowding since the Nico Jenkins thing. He's been doing it regularly. He's going in. He's got another person going in. You guys have been trying to oversee what's going on, and you guys just been doing your thing, and all of a sudden, somebody got the itch to just pull the plug. And I'm not really clear. If you can't say, just say I can't say. If you don't know, that's different than I can't say. But if you know, what is going on? This is crazy stuff. Have you guys not being able, just like telling the detective department at the OPD, you guys can't go out and talk to people at crime scenes anymore. Just stay in your office and people will call you.
I mean, we don't know definitively. One.
Guess.
Two
Can you
is
guess, yeah.
that in the government oversight community nationally, we are all certified inspectors general. We keep up on that certification, and I just returned from a training with the United States Ombudsman Association, and it is normal that government oversight agencies get attacked, and it becomes political. Especially if you're doing a good job at government oversight and accountability and shining a light. So we have heard a lot of stories and about different jurisdictions across the nation that go through these times. I think that's made for us to feel better when it does happen, but it is hard. But I don't, just to say that in government oversight community, it happens. Not
When
like
those
this.
other-
It's never happened like this, I don't think.
Yeah.
When those other places go through these types of times, like, is there a common reason? Is there an event that happened before that seems to be consistent or something like that? Or it's just sporadic for whatever reason?
I mean, it depends on where a light is shined, what politicians, I mean, each jurisdiction is different, I would say.
I know, I think that's true. I think in general, accountability can be uncomfortable. So I don't, but it's an interesting question, but I have no idea about whether there's a pattern. I haven't thought about that.
I don't think it's a pattern. We all know it's right-wing attorney generals and governors who you can't do anything with, and right now. And I would not be surprised if something would come forth in January when the legislature goes back.
That's what I'm
So, you know, we always talk about this transparency, you know, but, and I understand you guys can't be, but that doesn't mean some of us can't be, so.
We got another question on the floor? Yes.
Just to follow up for understanding, so the Inspector General has issued an opinion. Can you say if that's initiated by the Inspector General, or is he always responding to a request for it?
The original request that we knew about, it came from Senator Lowe to clarify. There was a hearing on a bill to clarify some of the provisions within the Office of Inspectors General Act that the law says how to do our work, and there was just some clarifications, and there were some folks that came to that hearing questioning whether these offices were constitutional or not. So Senator Lowe asked the Attorney General to issue an opinion. The opinion came out, and it turns out that the Department of Correctional Services and the Department of Health and Human Services asked for the opinion, and that is who the opinion is written to, those two departments.
And the opinions on the Attorney General's website, if anybody wants to, you just look up Nebraska Attorney General opinions and you can read for yourself too.
I want to throw out a different question. Ryan, I'm going to call out Dr. Ryan. I'm going to just a question here. I saw you over there. Don't be... One of the concerns we've talked about and more is how do we bring the academic community more into what other people are doing? I know they issue their report. You do a number of scholar reports and so on. Is there any relationship between the academic community and what they do and what you do? And again, I don't want to put you on the spot, which I just did, but is there a way to develop some kind of, because they say there's some outreach issues that doesn't get addressed. Is there a possibility of maybe getting more research from the academic community in our criminal justice or juvenile justice system to help us get more knowledge for our community from your vantage point?
Kind of, sort of.
By the way, have you done any work with him at any point in the past? Have you seen the reports? Tell me a little bit about your department.
Dr. Ryan Spahn, I'm director of the Nebraska Center for Justice Research. We're at UNO. We have a fantastic school of criminology and criminal justice, train a lot of professionals that work in the business. We also have a research center called the Juvenile Justice Institute. They do a lot of the juvenile violence prevention that's called community-based aid that comes through the Crime Commission and goes out to community organizations across the state. So we do a lot of evaluation and research to try to assess and improve the effectiveness of reentry programs. So we have a vocational life skills reentry program across the state of Nebraska that we work with. We recently began evaluating the programs that the Department of Corrections themselves run. So they're clinical programs and they're non-clinical programs. We're evaluating the Violence Reduction Program, BRP, right now, as mentioned in the report. So Doug is able to, his office is able to speak to us about, hey, you know, there's some things going on where there's a backup of individuals making it into community. And the community facilities are when you're stepping down, you're probably towards the end of your sentence, and this is where you can rebuild those community connections, you can be on work release, you can leave to participate in community programming. And some of the research that you're doing, can you look into, you know, what seems to be the case there, things like that. So we communicate, we're doing reports, we're putting things out there on our website, the Nebraska Center for Justice Research website. That can be a resource to what Doug is doing. So we work side by side, I would say. Like our worlds, we're in the same world, but like we are not connected agencies. My center was officially created by the legislature, so we are loosely affiliated with the legislature, and we try to, you know, if the Judiciary Committee has things that they want to look in, we looked into good time. So we have a report when some people are like, well, maybe we should get rid of good time in the system, which personally I'm like, nah, maybe we shouldn't, but as a researcher, we looked into the data and we provided a report that said that good time is being used in a very equitable fashion across race and gender. Things of this nature, but it seems to be working the way that it should work. And our good time laws didn't change, so it's one of those things where you do research and a law doesn't change, and that's a good thing. So that's the kind of stuff that we do. We're at the, let's look at the larger issues and see if we can create efficiencies where we can do things more effectively and more cost effectively and get people through the system in a better fashion. Yes.
Does that mean the new unit that you're building is going to house an academic or educational, vocational, rehabilitation department?
It's not my facility. That new facility. Wait, hold it. I don't know about that.
That'd be a question for Deb.
Right, I'm an employee of the university. I'm not an employee, but to answer that, hopefully, and because we were, I mean, just personally, like we don't need more prisons. Now, there's the idea that a new prison will replace NSP, and NSP will be mothballed. There's also rumors that no, it won't be wrong. But you know, to the extent if we're going to build a new prison, that's our position. Is NSP is old, right? And it wasn't built in a time when, you know, getting programming and rehabilitation was an issue. There's a lot of things we know about the science of delivering evidence-based practices and trauma-informed care and those sorts of things. So there will be more room for programming. There will be better room for programming. It will hopefully be more trauma-informed and more adept to delivering evidence-based practices. And to the extent that it's not build it and you will fill it, that it's replacing a facility that is not trauma-informed or very useful for delivering programming, it should be a whole lot better in that area. But there's not going to be like a lot of new things or new reentry sorts of things that are going to come about because they build a new building. It will still be, there still will be reentry staff just like there are now. They'll just be working in a nicer, hopefully more more effective, a fancier, more effective environment, hopefully.
Ryan,
But
you know what's a
programming won't
concern?
change that
How do you
much.
know so much about that? Are they going to tell me what they're doing in prison right now, the new building? Are they sharing? I didn't know they share that to the community. Are they sharing that out, what they're doing with the new buildings down there?
No, I mean, no, I don't know anything that isn't in the
Okay.
press. But I mean,
Okay.
just like it's like the new juvenile justice center. Like we got a new juvenile justice center because it's 100%
Okay, gotcha.
trauma informed and that
Gotcha,
sort of stuff.
okay.
And it just, I mean, it's just we don't. Everybody builds more effective
When they brand new,
places.
they make
right.
it better. Gotcha.
I mean, it's just
Yeah, question back. I'll leave it
So,
back.
just to preface it, you do research pretty much neutral with leaning to best practices.
right.
And so I see you speak in legislation, and overwhelmingly when I see you, it's towards what I'll just define as smart justice. Would you agree to that?
Smart on crime as opposed to dumb on crime. I mean, tough on crime.
Kind of basically along the lines of when they asked for a report for a new, and they paid that outside company for a new report on should we get a prison, and instead they got no, what you should have get is this, do this, cut sentences because of this, don't do this, and all of it was talking about how we're doing the system, if we're gonna say the system is right in any way, how we're doing it wrong, and we're making more incarceration, longer incarceration. And your research continuously, I just wanna establish that your research, in your opinion and not mine, has more overwhelmingly leaned towards that smart justice.
Right.
That's all I want to hear is
right,
on the
not-
record.
Wait, this crosses.
Not-
Hold on,
not-
we got to get back to the panel member here. Wait, this is not no side conversation.
Not just warehousing
Yeah.
people, but rehabilitating people.
Other questions for the panel members and folks. Y'all, hey, okay, you know Oshman's going to be the moderator here now. Remember that. Other feedback.
Can I say,
Yes.
I mean, the Center for Justice Research, the legislature, like Brian said, they created them. And, I mean, they do such good work for the system. And the legislature 20 years ago or so created the Juvenile Justice Institute, and with the whole point of them helping the legislature understand more about those systems. And so both of those entities have been huge and very significant. Really, that was some good thinking by the legislature. And my boss back in the day did the juvenile justice one, so I'll give her some credit.
Other questions, other feedback. But I want to throw one thing out, and Doug and I have had this conversation. I don't know if Julie and Jennifer have had it, but one of the things we've pushed in our organizations for organizations and state government to have advisory committees or do periodic listening sessions. And so the question is, again, I'm putting them on the spot here, is there an opportunity to do something like this in a much more continuous fashion so that we're not surprised when we get some crazy opinions or whatever? But can we look at doing that within the auspice of your offices or even in formal manner that other organizations do when they have JADI or what other groups like that? So my question is, are you empowered to do something like that, and you meet some wonderful people in the room like this, you say, hey, I'd like to consult with you or do stuff as an advisor? Is that a possibility? That's a long-winded question, but can you start an advisory committee? I didn't mean to put you on the spot though, but I did.
Yeah, and I mean, we have the ability to do that. Also, there's been times in my past where I have gone and sat at the library in Kearney, Nebraska to hear from anyone who's concerned about the YRTC in Kearney, for example. And so, I mean, I am very open to doing that, not during government business hours, but in the evening or weekend or something. In communities, I would love to do that and hear from more community.
Okay.
Yeah.
Did you have something to say?
I just said like neighborhood association.
Yes,
you should speak of neighborhood
yes.
associations, huh?
So Doug has done this.
Yeah, I mean, we try to get out of the we just have to make sure people know we're out there so that they can know to ask us to get out there and everything. So, I mean, I just accepted an invitation to speak to the Friends and Family Group here in Omaha at the end of October. And I used to go listen. I used to go just listen to them on a regular basis, and then COVID hit, kind of messed up everything. And I mean, there's a few different groups like that we used to go.
By the way, some people know what Friends and Family is. What does that mean?
It's a Friends and Family of inmates group, and they meet at a local church the last Saturday of every month. And there was one in Lincoln too, and I don't know if that one, I think that's kind of faded away. I'm not quite sure. I'm going to reach out to them. I kind of forgot about them because I hadn't heard from them, and then I saw something a few weeks ago. But they meet and they have people that, people who were incarcerated, the family members of people who are incarcerated, they bring in guests to talk and everything. So, yeah, it's a really good group. I'm looking forward to listening to them at the end of October.
Folks, are there any more questions or comments? We don't have a problem stopping early. And again, one of the things we want to do is give people an opportunity to raise things or questions, particularly those who haven't said anything. But yes.
I'll just make a comment. I want to thank you for having this forum because I wouldn't have known any of this if it weren't for tonight. So please continue to have forums like this. Yeah, right. Yeah, right.
I like to hear things
Stop.
like that twice.
Yeah.
Well, get in front of the camera and say, my name is Oswald Biden, running for office one day or to the office. Okay, appreciate that, bro.
But I really mean that. And I guess my walk off from this is I have a new fear that probably the three of you and you, Dr. Ryan, probably are more informed with what's really going on than the legislators. Mm-hmm. And if there's nothing in place to make them be informed of the data that you all collect and put together, I know everybody has their thing for their different geographical areas that are of importance that they specialize in, but I'm not sure that the best and the brightest are the ones that can affect change in these areas. So, but that's why I think this was important tonight. So I just really appreciate it. So we know who not to vote for all across the state, you know.
I would like to just share that. I think right now there's a lot of interest in the legislature. I know especially on corrections issue, and I think on Jennifer's issues too. And there's a lot of new senators that came in who've been getting out to prisons and going to parole hearings, things like that. They're really, and they're not even just from Omaha or Lincoln too. We have people outside that are really interested. And I know just 2 new senators were down at Tecumseh this week visiting the prison and watching some parole hearings. So there's a lot of interest. It's really encouraging, and I think that was one of the things when they created our offices, to keep them more educated and aware of what's going on, and that's what we've done. Good. That's a really, thank you.
Any other closing comments before I get my closing comments? I haven't made some announcements or anything, but anything on the last part of our speakers? Look who walked in, excuse me. Oh, okay, welcome. Look who's here. Any last closing comments before I give, I'm just gonna give some announcements at the end.
I would just, thank you for having us. This is very important, and I'm so happy to meet all of you and to be here. Please reach out to our office. Even if you don't have a complaint, but you think we should have information on how a system is running, we take information too. And that is a very important part of our roles. Without information coming in, we really don't have an understanding of what's happening. We don't know what we don't know. So thank you.
No, I would agree. I'm really grateful to be here. And if there are, as you mentioned, groups that we should be in touch with, that would be great, because I want to make sure that people know about us, the people most directly affected in the system. But they also have a lot going on in their lives, so I want to be very mindful of how we are approaching them and ways that are best for them, and so I think working with community groups would be incredibly helpful to that. So.
And I'll probably just add on and say, always make sure and let your senator know that you're interested in this, or you have information that you want to share. I know Senator Wayne and the Judiciary Committee will be holding some hearings this fall on various issues. Some of the things that are in front of them that relate to corrections would be like transitional housing changes, mental health in the corrections system. I wrote down another one. Looking at the status of the studies that Dr. Spahn talked about with classification and the programming and all that. So there's going to be some opportunities to weigh in on those things for the public, and so I think that's a really good way to let your elected folks know what's going on, what you feel, and what you're hearing.
Good. Well, folks, I really kind of close down by saying I really appreciate our 3 board members are here tonight. Rachel, Kimmer, and Dennis, and so they're part of the board that helps keep me honest and straight, and that's not easy, y'all, but we appreciate them being
I
here.
have to pull the hook out.
So somebody's holding on to all the counter, because I know the guy. I saw him one day, but anyway. The other thing, folks, is we're kind of excited that we're moving at a different stage, because our goal is just to bring the worlds together, and I just want to announce some other events we have planned, and we invited the public, but we've invited Thomas Riley, the public defender in Douglas County, to come out, and he's going to be at North Star on the 12th of October. It's going to be from like 6 to 7:30. It's one of the first time he's been in the community in probably like 15 to 20 years, but we're happy he's coming out. And I might have been the last one to host at that event, but we're happy he's coming out to talk about some of the things that are going on with some of the issues where people are being locked up and some of the challenges his office faced, but just our whole criminal and juvenile justice system. So he's going to give more of an update, but also be open to sharing that. And we also have one of the board members been in the system, and he said he had a very positive experience with the office, but again, there are different people with different points of view. So that's October the 12th from 6 to 7 at North Star, and go to our website to sign up for that. So just want to make a shameless plug for that. The second thing we got coming up is there's a book, a person who lives in Lincoln read a book called Decolonizing Wealth, which is written by an indigenous author, Native American, about how donor community can do things differently and how they give money out in our community. And so a couple of our board members read it, and she asked us if we would do kind of a book discussion on that. It's going to be virtual, basically on the internet, Facebook Live, as well as Zoom. But go to our website, and we'll ask you to read the book. It's easy to read. I read it. I liked it. In actual fact, one of our board members was so excited about it, she wanted to spend a significant amount of money of our budget we can't afford to give it to people. I'm like, no, we can't do that. We're not that rich as a nonprofit, a small nonprofit, but she liked it that much. But we want to talk about how do we give money and how do we get people to make sure it goes to some of the most neediest groups who are doing the most active work. And most people don't know more is a pure volunteer board. We don't really have paid staff, but we do a lot of stuff just by volunteers and the goodwill of our board members. So that's one of the things this book is very helpful. And then the other thing we're going to do, and I just may pull this one out, we're going to show a video called A Time for Building. Some of you may know that Senator Chambers and Pastor Young Dog did a fascinating documentary in 1966 about integration of churches and so on. It was nominated for Academy Award. It didn't win. It was 4 nominated, but didn't win. But it became a classic piece. And I usually showed it in my class, but I found out through, as we say, we know different people. Paul brought to my attention a follow-up called A Time for Building. And what's fascinating about this is some of the whites who are involved in that have private conversations just among whites about that whole integration issue and some of the backstory. So we're going to show at the church where it actually happened on October the 25th from 6 to 8. We're inviting the faith community to talk about that video, but it's going to be a different video called A Time for Building. So it's kind of like the next steps. And so Paul's going to say a few words. And the guy named Mark's going to say, and then the pastor of the church is going to say something, and yours truly is going to be the facilitator again of this kind of discussion. Now, how do you talk about race, particularly from a faith base, and looking at this video, something that was done in 1966. And when I've shown it in most of my classes over the years, students are surprised it took place in Omaha, and we haven't come that far. So it's going to be interesting to have people from different communities talk about that. So that's our other item that we have planned. Then there will be some other issues in the future. So just want to say
which church?
Augustanos Lutheran Church at 3647 Lafayette Avenue. You can register on our website, moreomaha.com. So go there and you can sign up for there. So we throw that out. But as we always end our meeting, folks, we really appreciate you being here today. And as we always say, may the force be with you. Thank you.